Hi, my name is Dr. Paul Marik. I'm the Chief Scientific Officer of the IMA, and we're going to discuss today a very interesting paper that has got a lot of public attention. So the title of the paper is called COVID Vaccination and Post-Infection Cancer Signals, Evaluating Patterns and Potential Biological Mechanisms. The two authors are Charlotte Kuperwasser and Wafik El-Deiry. This paper comes from both the University of Tufts as well as Brown University. This paper was looking at basically a narrative hypothesis generating review, looking at the temporal association between COVID-19 vaccination and SARS infection and epidemiological data on cancer. So they performed a review from January 2020 to April 25 across multiple databases and web sources to collect reports of cancer appearing after COVID-19 vaccination and infection. So they found 69 publications, 66 article-level clinical reports, and this included 333 patients in 27 countries, and which included two large population-level cohort studies. So what did they find? Well, so they were looking for infection, post-infection, and post-vaccination. It just so happened that 87 or 89% of the cancers were post-vaccination. So that's important. The people are going to spin this as a consequence of SARS-CoV-2 infection, whereas indeed it was the vast majority of cases were post-vaccination. And so out of these 333 cases, what did they find? Well, the cancer types were hematological, non-Hodgkin's lymphoma, cutaneous lymphoma, leukemias. In terms of solid tumors, breast, lung, melanoma, sarcoma, pancreatic cancer, glioblastoma. Surprisingly, there were many cases of pancreatic cancer, predominantly in the solid tumors. And there was a certain pattern associated with these tumors. And this has been reported before in studies on so-called turbo cancers. In our paper on turbo cancers, we similarly reported a similar pattern. And so what they found was rapid progression of the tumors, recurrence or reawakening of previously indolent or controlled cancers, tumors occurring close to the injection site, and in terms of time, there was a clustering within weeks to months of vaccination. So this becomes important because in the Korean study, which looked at over 8 million patients or 8 million citizens vaccinated versus non-vaccinated, they looked at the hazard ratio of cancer in the first year. And the biggest criticism of oncologists is cancer doesn't happen in a year. The lead time is years, which is obviously not correct for cancers associated with the vaccine, because in this study, as in multiple other studies, there was a clustering within weeks to months after the vaccine. So what happened when this paper was published? Well, as would be expected, Big Pharma wasn't happy. So some unknown agent tried to shut down the journal. There was a cyber attack on the journal, and they successfully shut down the journal due to the cyber attack. So apparently the FBI have been involved. And then it generated an enormous firestorm in social media, attacking both the authors, but particularly Dr. El-Deiry, attacking him personally, his competence, and basically undermining his integrity. And he did fight back. So it seemed like there was a concerted, organized, well-orchestrated attempt to shut down the journal, shut down the paper, and prevent the paper being distributed. But in fact, it's had the opposite effect. Because of all the publicity and because of all the attention, all the social media, this paper has now been widely distributed across the world. This attempt to hide the data has now completely backfired, and the results of this paper, which obviously been reproduced multiple times and obviously accurate, have been distributed. What is even more interesting is the second author, who's one of the oncologists been communicating, Dr. Wafik El-Deiry. He actually got a job offer from Pfizer. Now, can you imagine such a thing so preposterous? He writes a paper highly critical of their vaccine and the enormous toxicity resulting from their vaccine, and Pfizer has the audacity to sincerely offer him a job. You can't make this up. And so this is another example of when true science results in data that's inconvenient to Big Pharma, and Big Pharma tries to shut them down. So clearly, cancers following the mRNA vaccine is a really important topic. We actually wrote a review paper on this topic, which is available in our journal. And for those people looking for more resources on cancer and vaccination and what to do about it, we have a cancer hub on the IMA website, and we would suggest that you visit the website and look at the information that's available.